All right. So for the next issue which we'll be looking at in heart failure is hypercapnia. So we're trying to establish a link between hypercapnia and heart failure in children. Can it be able to cause heart failure in children? All right. If yes, what is their link? So hypercapnia just have to do with the carbon dioxide. Carbon dioxide is too much in the body. So carbon dioxide is a waste product produced by cells, should be put out of the body. Oxygen is the one that is delivered to the cell for proper functioning. You understand that kind of thing? So if carbon dioxide levels are getting too high in the body, you have a hypercapnic issue. So hypercapnia is just an elevated levels of carbon dioxide in the body. It can contribute to heart failure in children, especially in the context of chronic respiratory illness or impaired ventilation. Do you understand? So while it is not always a primary cause, if it combines with any other complications, it makes it worse. Okay? So hypercapnia occurs when oxygen, that's carbon dioxide production, is exceeding how the lungs should put it out. Do you understand? So ventilation is impaired. It could be that the person has lung illness, it could be neurological issues, it could be airway obstruction, of course, but mostly primarily the person have issues with their lungs. So in children, it can be there because of things like bronchopulmonary dysplasia, severe asthma, neuromuscular disorders, like can't be able to maintain the muscles that lift up the chest and down. Obstructive sleep apnea is there. Congenital central hypoventilation syndrome is also there. Alright. So how hypercapnia leads to heart failure? So pulmonary vasoconstriction leads to what? Pulmonary hypertension. So high carbon dioxide levels causes vasoconstriction in pulmonary arteries. Please let me just pick up this picture. This congenital central hypoventilation syndrome. So high carbon dioxide levels cause vasoconstriction in pulmonary arteries. This increases pressure in the lungs. It forces the right ventricle to now work harder than it should. Okay, so over time it leads to right-sided heart failure. That's called pulmonary. Then acidosis induced myocardial depression. So carbon dioxide retention leads to respiratory acidosis. So acidosis impairs calcium handling in heart cells. This reduces contractility. So this can lead to low cardiac outputs and ventricular dysfunction. So increased sympathetic drive too. It stimulates the sympathetic nervous system, raises heart rate and blood pressures and all of that. So chronic stimulation can lead to cardiac remodeling and eventually can lead to heart failure and hypoxia coexistence. So if hypercapnia, that's high carbon dioxide, is existing with low oxygen delivery, this could actually lead to much more pronounced issues. Okay, so that's it for how hypercapnia can be able to cause heart failure in children.